Hello, let us now study the Norma frontalis. So, when you view the skull from the front or studying of the skull from the front, we call it as Norma frontalis. The bones seen here are unpaired bones are only two. This is a frontal bone and the mandible, and the paired bones include the maxillae. These are the paired maxillae, the zygomatic bones, and the two nasal bones and the two nasal bones. In this, the nasal bones are broken. I am showing it here, these two nasal bones. Okay. Now, let us see what are the sutures seen from the Norma frontalis. We have frontozygomatic suture, this one. This is frontozygomatic suture, here you see frontozygomatic suture, which is the meeting point of zygomatic process of frontal bone and frontal process of zygomatic bone. So, this is frontozygomatic suture. Then we have here between this frontal bone and these two nasal bones here, this suture we call it as frontonasal suture. It is called as frontonasal suture. Similarly, here between the two nasal bones here, we can see a thin suture here between the two nasal bones. This is called as internasal suture. It is called internasal suture. Then we have one more suture here, which is zygomatico-maxillary suture. Zygomatico-maxillary suture. And the last suture I can say is in between the two maxilla here, which can be named as intermaxillary suture. So, these are the five sutures which can be seen from the front. I repeat, frontozygomatic suture, frontonasal suture here, internasal suture, zygomatico-maxillary suture and intermaxillary suture. The features in the Norma frontalis, although mandible will read separately, mandible is a part of the Norma frontalis, but I will take it in a separate class. There are three major openings here. What are they? Two orbital openings and one anterior nasal aperture. This one is anterior nasal aperture and two orbital openings. If you see the anterior nasal aperture here, it is pyriform in shape, being wider below than above, and to the margins of this anterior nasal aperture we have the nasal cartilages attached to it, and the upper border is formed by the lower border of the nasal bones here, and we have this internasal suture here. The internasal suture meets with the frontonasal suture, and that is called as the nasion. The meeting point of the frontonasal suture and internasal suture is called nasion, and the lower part of the internasal suture here is called as rhenion. It is called as rhenion. In the upper border of the anterior nasal aperture, there is a notch here. This notch is meant for the passage of external nasal nerve, and in the lower part we have a spine which we call it as anterior nasal spine. Here it is more pronounced. It is called as anterior nasal spine. This is all about the anterior nasal aperture. Now, coming to the orbital opening, it consists of upper border, lower border, medial wall, lateral wall. It is having a base outside and the apex is projected into the interior. Base is outside and the apex is projected interior. The upper border is formed by the frontal bone and it consists of this notch which is called as supraorbital notch. Supraorbital notch, and this notch transmits supraorbital nerve, supraorbital artery, and a vein communicating the angular vein with the superior ophthalmic vein. All these are the contents of this supraorbital notch. Then this is the inferior border, inferior margin, which is formed by the maxillae, and this is a lateral wall which is partially formed by the frontal bone and partially by the zygomatic bone, and this is a medial wall which is formed by the frontal process of the maxillae and the lacrimal crest. Coming back to the features in the midline, you can see a curved region here which is called as superciliary arch. This is called as superciliary arch, and the region between the superciliary arch, this one we call it as glabella, and the portion just above the superciliary arch is more pronounced here, particularly in females, which we call it as frontal tuberosity or frontal eminence. Now coming back to the other bone, that is, this one is the maxilla. This maxilla consists of three processes, one towards the sockets, alveolar sockets, we can call it as alveolar process. The one going like this by the side of the nasal bone, this we call it as frontal process of maxilla. Posterior to it is the lacrimal crest, and one more downwards which is palatine processes of maxilla, which is unites to form the hard palate. Okay. So from the front, if you see, below this one we call it as incisive fossa, that is the portion adjoining the incisive sockets of either sides, these four incisive sockets, and the portion adjoining we call it as incisive fossa. By the side of it, there is, although broken here, there is a canine eminence, a projected part adjoining the canine socket is canine eminence. By the side of it is the canine fossa. Now coming to this zygomatic bone, it consists of a foramen which we can say it as zygomaticofacial foramen transmitting the zygomaticofacial nerve, and on this maxilla we have infraorbital foramen, this one transmitting the infraorbital nerve and vessels. Coming to the muscle attachments in this region, to the superciliary arches, it is the corrugator supercilii which is attached, and to the nasal bones, it is the procerus which is attached, and to this one, this is a frontal process of maxilla, to which is attached the orbital part of orbicularis oculi, medial palpebral ligament, and a muscle called levator labii superioris alaquae nasi. And in the region between the infraorbital margin and infraorbital foramen, this region gives attachment to levator labii superioris. Below that, above the alveolar sockets is levator anguli oris, and on the zygomatic bone, more laterally is zygomaticus major and more medially is zygomaticus minor. On the incisive fossa, it should be depressor septi muscle. All these are the muscles of the facial expression which are attached or which are seen on the Norma frontalis. Thank you.